It's time for Checkup with Dr. G.
Checkup with Dr. G. The doctor is in, Dr. Michael Garver. One of the questions I like to ask physicians is, why? Why did you get into the field of medicine? What was the impetus for you to say, this is what I want to do?
I think for me it was more of a calling, and my father was a PhD, and so I came from a background where science and experimentation and working in the lab was a standard thing that happened throughout my whole life. And so that burning question of why, which is what you ask, is something that came natural. And so as I grew up within that environment, I became more and more interested in clinical medicine, and also did some basic science research. And so it was at a young age where I decided that medicine was really a calling, and that's something that I wanted to do, and wanted to do what I could to help people and be available.
Now, your business is called Premier Care Pediatrics, so you specialize in pediatrics, and that is part of a calling in itself. What is the... I think one of the things that I hear about your practice is that you're available like almost around the clock. How does that work?
Well, when we set up this solo practice, I had to figure out a way in order to be accessible to families. And so since we specialize in outpatient care, what happened is that I didn't want people to get a message on the phone that,
we're only open from 8 to 5, so call another day.
Or the office is closed, you missed Dr. G, and it's too bad. And so what we did was we came up with technology and used a phone to where the telephone here rolls over into my phone, and people can contact me on weekends and holidays, and basically 24/7.
That kind of means some sleepless nights and early mornings, I'm sure, but that's the passion that you bring to this profession you've chosen.
Art, it's really surprising to a lot of people, and you would think that the phone would ring off the hook. And many of the patients, it has to do with training. So when you teach people how to take care of their children, then they don't need to call you. But during those times where they need some reassurance or need some guidance, then I'm available.
In the old days, you used to have the family doctor where just about everybody in your family went to the same person. That is the sort of direction you're taking from babies till what age?
We don't really have a cutoff. We've tried that, and we have children in college and young adults and people that come back here, and they still get seen.
How important to that is that to the family?
I think being available to the family and having somebody that you trust is critical, and the choice that they have to make, I stress upon them, is very important, and we hope that people, the word gets out through this program that we do something special here.
All right, we have a couple of seconds left. Let's tell folks where you are.
Okay, we're at 916 13th Avenue South, which is very easy to get to, and our phone number is 770-3000, and we have a great staff, and they look after the patients along with me.
Excellent, and that's our program for today.
You've been watching Checkup with Dr. G.
Premier Care Pediatrics, where your family comes first.